Welcome to Telli Bear's Techy Tidbits, lovingly hosted by AI. Today, we're going on a really amazing journey. A journey into the magical and, honestly, rapidly evolving world of medical skin patches. We're going to explore how something as simple as a sticker is totally transforming the very future of medicine, step by wondrous step.
So to start us off, I want you to think about something super familiar. Have you ever slapped on a motion sickness patch right behind your ear before going on a bumpy boat ride? Or, maybe you've seen someone use a medicated pain patch for a sore shoulder. We use these incredible little marvels in our everyday lives all the time. They just stick right to the skin, quietly do their job, and we honestly barely even notice they're there. But those everyday patches, they represent just the base of a very tall, very exciting staircase of wonder.
Which kind of leads us to a really fascinating question. What if a simple sticker could do, well, way more? What if, instead of just delivering some basic medication, a patch could actually listen to your heart, or decide to heal a wound, or even use sound waves to keep a heart beating in perfect rhythm? That is exactly the astonishing future we're about to explore together right now.
Section 1. Patches that listen. Let's look at how patches have evolved to continuously monitor our bodies, and doing it without a single needle or wire. You see, for the longest time, healthcare has relied heavily on what we can call snapshot medicine. It's kind of like taking a single photograph, right? You go to the doctor, they draw blood or check your vital signs, and they get a snapshot of exactly how you're doing in that specific moment. But our bodies are super dynamic. They're changing all day long. So science is shifting toward always-on medicine. Instead of just a quick photograph, imagine recording a continuous, non-invasive video of your health.
And this shift, it's already happening. Comfortable, always-on electronic skin patches are literally here, right now. They just rest gently on the skin, and they can continuously listen to a person's heart rhythm, track the tiniest subtle changes in skin temperature, and even monitor glucose levels all day long. The patch has basically become this silent, comfortable companion that simply listens.
Section 2. Patches that act.
So building on patches that just listen, we're now seeing patches that can actually take action. Take a look at this incredible piece of technology known as the iSafe Smart Electronic Wound Bandage System. It basically looks like a super flexible, golden, high-tech sticker. But this isn't just a basic cover to protect a scrape. It's a whole closed-loop system that brings some seriously advanced, battery-free tech directly to the surface of the skin. Here's how it actually works. First, the patch actively listens to the wound, looking for infection markers like sudden changes in pH levels or temperature. Second, it processes that information to figure out exactly what the wound needs right then and there. And third, if it senses an infection starting to brew, it automatically releases localized antibiotics to help heal it up. It notices a problem, makes a decision, and then just acts on it. How cool is that?
Now, I do want to be totally honest and warm with you here. This specific tech is still in the preclinical stage. While there are clinical trials and really solid peer-reviewed science backing this up, it is still early days. But honestly, that's exactly why it's so wondrous. We're getting this magical peek right into the scientist's workshop, watching the actual future of intelligent bandages being built right before our eyes.
Section 3. A Playful Detour.
Because beyond traditional patches, scientists are exploring other amazing ways medicine can use skin contact. Enter chromogenic biosensing ink. This is a super special kind of tattoo ink that actually changes color based on the chemistry of the interstitial fluid. That's just a fancy term for the fluid right beneath the surface of your skin. It literally makes your body's internal chemistry visible at a single glance. Oh, and absolutely no batteries required?
So depending on what your body is doing, the ink physically reacts. If your pH levels change, the ink might shift from yellow to blue. If glucose levels rise, it can transition from yellow to a dark green. It's funny, my extra-large virtual pet plant, Fernie, actually turned yellow this week from getting way too much virtual sun on the screen. And it's remarkably similar to how these tattoos change color to reveal our hidden health data. Now again, these are currently only in pre-human trials, but just imagine a future where a beautiful tiny piece of body art acts as a natural, glowing dashboard for your well-being.
Now, for our grand finale, Section 4. Patches that reach inward.
To really understand this next frontier, we need to consider a crucial number: 3 million. Over 3 million adults in the United States alone currently live with traditional pacemakers. These are absolutely incredible, surgically implanted devices that save millions and millions of lives every single day by keeping hearts beating in a perfectly healthy rhythm. They're a massive testament to just how far medicine has come.
But What if we could reach that same life-saving destination through a completely different, totally non-invasive route? Well, in June 2026, researchers at MIT published a study in Nature Biomedical Engineering unveiling exactly that. It's a wearable, non-invasive ultrasound pacemaker, a pacemaker that doesn't use electricity to pace the heart, but sound.
To understand how this magic actually works, we get to learn a really beautiful, empowering new word, sonogenetics. It's basically the combination of acoustics and genetics. It's this incredible scientific field where cells are genetically engineered to respond directly to sound waves. So essentially, scientists are giving heart muscle cells the ability to literally hear.
The biological sequence behind this is just poetry in motion. First, specialized ion channels in the heart are primed to hear targeted ultrasound waves. Second, when the sound wave hits them, those tiny channels physically open up, almost like little doors, letting a rush of calcium into the cell. And third, that sudden calcium influx, that is the exact chemical green light a heart cell needs to squeeze and trigger a heartbeat. So sound literally dictates the rhythm of the beating heart. Mind-blowing, right?
And where exactly does that sound come from? A simple, postage stamp-sized hydrogel sticker resting gently right on the outside of the chest. There are no wires passing through the skin at all. There's no invasive surgery. Just a tiny, super comfortable sticker doing all the heavy lifting of a traditional implant, just by sending soft acoustic pulses into the body.
Now, it's super important to understand that this requires a two-step clinical approach. The sticker can't do this completely on its own. First, a patient would receive a one-time gene therapy injection, which is actually really similar to some existing FDA-approved treatments, and that permanently primes the heart cells to listen for the sound. Once the heart is primed, step 2 is simply wearing the sticker, which sends the acoustic pulses to keep that perfect rhythm going.
And I want to be deeply honest about where we are with this technology today. It has been successfully tested on engineered human cardiac cells in a lab. It's safely and effectively steadied regular heartbeats in live rat and porcine models. But human trials are the next frontier. There is definitely uncertainty ahead and a lot more testing to do. But you know what? That uncertainty is a beautiful part of the scientific journey. It's totally okay that we don't have all the answers yet, because the path forward is just filled with so much grounded hope.
As we look toward tomorrow, I want to leave you with this final thought. If there's one thing you'll remember from this, let it be that some of the most powerful medicine in the future might not come in a bottle or surgery. It might come in a sticker.
What internal mysteries will your next sticker reveal? Thank you for listening to Telli Bear's Techy Tidbits. I hope you have a magical day. Stay curious, stay kind, stay safe.